Welcome to Bella Academy RN. I'm so glad you're here. This is your 45-minute nursing exam crash course, covering every high-yield topic that shows up on your exam. Let's get you that pass. Before we dive in, I need you to understand something that will change how you approach every single question. This exam is not testing how much you've memorized. It's testing one thing. Can you keep your patient safe? Every question is built around prioritization, critical thinking, and patient safety. The exam tests three things consistently. First, prioritization. Who needs care first and what is most urgent right now? Second, clinical judgment. The ability to recognize cues, analyze them, and act. Third, patient safety. Every question is rooted in safe nursing care. The nurse who thinks the safest passes the exam. Here is what we are covering today. Section 1, Test-Taking Strategy. Section 2, Prioritization and the ABCs. Section 3, Delegation. Section 4, the Next Generation Clinical Judgment Model. Section 5, Safety and Infection Control. Section 6, Pharmacology Essentials. Section 7, Medication Calculations. And Section 8, High Yield Rapid Review, Cardiac Respiratory, Maternity, Neuro, Diabetes, Psych, and more. Once you see the patterns, you stop guessing and you start passing. Section 1, Test-Taking Strategy. Most students don't fail from lack of knowledge, they fail from how they answer. Let's fix that right now. Rule number 1, avoid extreme words. If you see always, never, or only in an answer choice, be very careful. Healthcare is rarely absolute. Extreme language almost always signals a wrong answer. That said, some absolutes are correct. Use your clinical judgment and read carefully. Rule number 2, select all that apply strategy. SATA is not guessing. It is a series of independent true or false questions. For each option, ask yourself, is this true for this patient right now? Select all that are true. And here's something important. Seeing SATA on your exam is not a bad sign. On an adaptive exam, SATA appears when you are answering at a higher level. That can be a very good sign. Rule number 3, your first instinct wins. Your very first read is almost always correct. Students who change their answers almost always change to the wrong one. Only change an answer if you have a clear, specific, logical reason, not because of anxiety. Rule number 4, when in doubt, pick safety. The exam is testing safe nursing, not heroism. The Next Generation exam, updated for 2026, follows the clinical judgment measurement model. Recognize cues, analyze cues, prioritize hypotheses, generate solutions, take action, and evaluate outcomes. For case studies, read the entire scenario before answering anything. Ask what is the primary problem right now. Watch for new information. It changes your answers. You cannot go back. Commit and move forward. Section 2, prioritization. This is the number one tested concept on your nursing exam. Master this, and you pass. Airway, breathing, circulation, in that exact order. Every priority question can be answered by coming back to the ABCs. Stridor versus fever. Go to the stridor. Oxygen saturation of 82% versus a wound infection. Address the oxygen first. Chest pain with diaphoresis versus nausea. Chest pain first. A respiratory rate of 30 with restlessness versus pain 6 out of 10. Address the respiratory rate first. Airway first, always, no exceptions. Maslow's hierarchy tells us that physiological needs, oxygen, fluids, nutrition, warmth, elimination, always come before emotional needs. A patient who is crying and has a low oxygen saturation. You treat the oxygen first. The exam will offer emotional answers that sound kind and compassionate. Don't fall for it. Always anchor to the physiological need first. Unstable comes before stable, always. Signs of instability, sudden change in condition, new confusion, abnormal vitals, active bleeding, severe chest pain, audible stridor, or an acute oxygen drop. Stable patients, chronic findings, controlled pain, COPD at baseline can wait. The golden rule, acute beats chronic. A new problem always beats an old one. Section 3, delegation. The most commonly missed topic on the nursing exam, and it does not have to be. 3 roles, 3 simple rules. The RN thinks. The RN assesses, teaches, evaluates, gives IV push medications, and cares for unstable patients. The LPN provides stable care, routine medications, stable patients, dressing changes. The UAP performs tasks, activities of daily living, vitals on stable patients, ambulating a stable patient, and transport. The golden rule, if the task requires clinical judgment, assessment, or teaching, it stays with the RN, always. Let's practice. Ambulate a stable post-op patient, UAP. Vital signs on a stable patient, UAP. Routine oral medications to a stable patient, LPN, routine wound dressing change. LPN, monitor after a blood transfusion. RN only. Assess a new post-op patient. RN only. Teach insulin technique. RN only. IV push medication. RN only. Routine and stable can delegate down. Judgment, assessment, and teaching stay with the RN. Section 4. Safety and infection control. These are easy points, if you know the rules cold. PPE order is always tested. Donning, putting on, gown first, then mask or N95, then goggles or face shield, then gloves last. Doffing, taking off. Gloves first because they are the most contaminated, then goggles, then gown, then mask last because it still protects your airway. Gown, mask, goggles, gloves on. Gloves, goggles, gown, mask off. 3 isolation types, airborne precautions, N95 respirator and negative pressure room. Diseases, tuberculosis, measles, varicella. Remember, my 2 viruses, measles, tuberculosis, varicella. Droplet precautions, surgical mask and private room. Influenza, meningitis, pertussis, mumps. Contact precautions, gown and gloves, private room. MRSA, C. diff, VRE, scabies. High yield point for C. diff use soap and water, not alcohol hand sanitizer. Alcohol does not kill C. diff spores. Restraints are always a last resort. Try the least restrictive intervention first. A provider order is always required. Check every 15 minutes, document the behavior and patient response. Remove as soon as safely possible. Maintain dignity at all times. For fall prevention, bed low, call light within reach, non-slip socks, hourly rounding. For suicidal patients, remove all sharps, cords, and belts. Implement one-to-one supervision. Section 5. Pharmacology Essentials. You do not need to memorize every drug. You need to recognize danger. 7 antidotes you must know. Opioids, naloxone, benzodiazepines, flumazenil, heparin overdose, protamine sulfate, warfarin overdose, vitamin K, magnesium sulfate, toxicity, calcium gluconate, acetaminophen overdose, and acetylcysteine, anaphylaxis, epinephrine, 1 to 1000 intramuscular, always first. Toxicity signs, vision changes and halos, digoxin, tremors and confusion, lithium, seizures, ataxia, nystagmus, phenytoin, respiratory rate below 12 with pinpoint pupils, opioids, peak T waves, hyperkalemia, before any cardiac medication, apical pulse 1 full minute, hold if below 60. High yield drug safety, part 1. Digoxin, always check potassium first. Hypokalemia dramatically increases toxicity risk. Heparin, monitor PTT. Therapeutic range 60 to 100 seconds. Warfarin, monitor INR. Goal 2.0 to 3.0 for atrial fibrillation. 2.5 to 3.5 for mechanical valve. Lithium, therapeutic range 0.6 to 1.2. Toxic above 2.0. Metformin, hold when EGFR is below 30, risk of lactic acidosis, levothyroxine, morning empty stomach, 30 minutes before eating. High yield drug safety, part 2. ACE inhibitors cause a dry cough as a class effect. Switch to an ARB if needed. Spironolactone is potassium sparing. Watch for hyperkalemia. Furosemide wastes potassium. Hypokalemia worsens digoxin toxicity. This combination is one of the most dangerous in nursing practice. Vancomycin must infuse over 60 minutes minimum to prevent red man syndrome. IV potassium, never IV push. Maximum rate is 10 to 20 milliequivalents per hour through an infusion pump. Aminoglycosides are nephrotoxic and ototoxic. Check baseline kidney function and hearing before starting. Critical drug interactions, MAOIs with tyramine foods, aged cheese, wine, cured meats cause hypertensive crisis. SSRIs with tramadol cause serotonin syndrome, life-threatening. Sildenafil with any nitrate causes severe fatal hypotension. Absolute contraindication. Clozapine requires weekly CBC for agranulocytosis. Know your drug suffixes. Olol is beta blocker. Pril is ACE inhibitor. Sartan is ARB. Statin needs to avoid grapefruit. Section 6, medication calculations, free points. Stay calm, use the formula, label your units, double check your math. 3 formulas, desired divided by have times. Quantity gives your basic dose. Volume divided by time in hours gives IV flow rate in milliliters per hour. For weight-based dosing, pounds divided by 2.2 equals kilograms, then multiply kilograms by the dose. Drop rate in drops per minute, volume times drop factor divided by time in minutes. Worked example, order 500 milligrams. On hand, 250 milligrams per 5 milliliters. 500 divided by 250 times 5 equals 10 milliliters. Label your units, convert pounds to kilograms. Free point, never rush. Section 7, High Yield Rapid Review. The topics that show up on every single exam, stay with me. Critical lab values: sodium, the brain electrolyte, normal 135 to 145, low causes confusion and seizures, high causes the brain to shrink. Potassium, the heart electrolyte, normal 3.5 to 5.0, low causes dysrhythmias, high above 6.5 can cause fatal cardiac arrest. Call the provider immediately. Magnesium governs reflexes, normal 1.5 to 2.5, low causes seizures, high causes respiratory depression. Calcium affects bones and nerves, normal 8.5 to 10.5, low causes Trousseau's sign and tetany. Critical values requiring immediate notification: potassium above 6.5 or below 2.5 comma, sodium above 160 or below 120, glucose below 50 or above 500, hemoglobin below 7. Cardiac high yield: left-sided heart failure backs up into the lungs, crackles, dyspnea, orthopnea, pink frothy sputum. Right-sided backs up into the body, pitting edema, jugular vein distension, ascites, weight gain. For STEMI, door to balloon under 90 minutes, 12-lead ECG confirms. Cath lab immediately. Ventricular fibrillation, no pulse, defibrillate, unsynchronized immediately. Ventricular tachycardia with a pulse, synchronized cardioversion. Before every digoxin dose, apical pulse 1 full minute, hold if below 60, check potassium. Respiratory high yield: ABGs, use the Rome mnemonic. Respiratory is opposite, pH down, CO2 up, or pH up, CO2 down. Metabolic is equal, pH down, bicarbonate down, or pH up, bicarbonate up. For COPD, target oxygen saturation 88 to 92%. Too much oxygen removes the hypoxic drive. Chest tube stops tidling, the lung has re-expanded. Tracheal deviation away from the affected side, tension pneumothorax, emergency needle decompression. Normal ABG, pH 7.35 to 7.45 comma. PASO 235 to 45. Bicarbonate 22 to 26. Maternity high yield: late decelerations, always bad. Uteroplacental insufficiency. Stop Pitocin, reposition, give oxygen, call provider immediately. Early decelerations: normal head compression, variable decelerations, cord compression. Reposition first. Preeclampsia with severe features, blood pressure at or above 160 over 110, magnesium sulfate and antihypertensives. Postpartum hemorrhage: fundal massage first, then oxytocin. Magnesium toxicity: stop the drug if respiratory rate falls below 12, deep tendon reflexes are absent, or urine output drops below 25 milliliters per hour. Calcium gluconate at the bedside, always. Neurological high yield: stroke recognition, fast, F, facial drooping, A, arm weakness, S, speech slurred, T, time, call for help immediately. Time is brain. Every minute costs 1.9 million neurons. Activate the stroke protocol immediately. For increased intracranial pressure, head of bed, 30 degrees, quiet environment, no hip flexion, Cushing's triad, hypertension with widening pulse pressure, bradycardia and irregular respirations, means brain herniation. Life-threatening emergency: autonomic dysreflexia at T6 and above, sit upright, find and remove the trigger, call the provider. Diabetes high yield: DKA in type 1 diabetes, fruity breath, Kussmaul respirations, pH below 7.35 comma, glucose above 300, ketones in urine. Treatment: IV fluids first, then insulin drip, then potassium replacement. HHS in type 2, extreme dehydration, glucose above 600, no ketones. Treatment: aggressive fluid resuscitation first, hypoglycemia, the 15 rule. Give 15 grams of fast-acting carbohydrates, wait 15 minutes, recheck. Unconscious patient, D50 intravenous or glucagon intramuscular. Psychiatric nursing, part 1, communication and safety. Always validate the patient's feelings, never validate their delusions. Never ask why questions. They sound judgmental. Use open-ended questions. Tell me more about that. For a patient experiencing hallucinations, acknowledge without reinforcing. I don't hear that, but I can see that you are frightened. For suicidal patients, always ask directly. Asking about suicide does not increase the risk. Highest risk: previous attempt, a specific plan with means, elderly, male, isolated. Psychiatric Nursing, Part 2, Medications. Lithium therapeutic range 0.6 to 1.2, toxic above 2.0. Tremors, confusion, seizures. Clozapine, weekly CBC required. Risk of fatal agranulocytosis. Mayo eyes, no tyramine foods, hypertensive crisis. SSRIs with tramadol. Serotonin syndrome, life threatening. Antipsychotics, watch for tardive dyskinesia, late onset abnormal movements, and neuroleptic malignant syndrome, hyperthermia and severe rigidity. Restraints are always the last resort. Provider order required, check every 15 minutes, remove as soon as possible. Additional high yield topics: blood transfusion reaction, stop the infusion immediately, keep IV open with normal saline, call the provider. Sepsis, 2 blood cultures, then broad spectrum intravenous antibiotics within 1 hour, then 30 milliliters per kilogram IV fluid bolus. Chest tube pulled out, occlusive dressing immediately, Vaseline gauze, notify the provider, pulmonary embolism, sudden dyspnea and tachycardia post-operatively, oxygen first, then CT pulmonary angiography. Post-operative assessment order: airway, breathing, circulation, level of consciousness, then wound. Let me leave you with this. You do not need to know everything to pass this exam. You need to think safely, you need to prioritize correctly, and you need to trust the training you have worked so hard for. The patterns in this exam are learnable, and once you see them, you own them. Stay consistent, practice every day, read every rationale, and believe in yourself. You will pass. A few last-minute study tips. Practice questions every single day, 75 to 100. The rationale is more important than your score. Read every one. Focus on your weak areas first. Use one trusted resource and go deep. Sleep the night before your exam. It is worth more than any last-minute cramming. On test day, eat breakfast, arrive early, bring your valid ID. If the exam stops at 85 questions, that can be a pass. Hard questions mean you are answering correctly and the exam is adapting upwards. Stay calm, think like a nurse. You have prepared for this. Thank you so much for spending this time with Bella Academy RN. If this video helped you, please like it and subscribe so you never miss new content. I post high yield nursing exam prep every week because I want you to pass. Comment below and tell me which topic you want next. Share this with a friend who is studying. We are in your corner. Let's get you that pass.